This next exercise that we are filming here will be addressing how to stand, so standing well, along with walking. So to start with, in standing, what we're going to start with is looking at the feet, or talking about the feet. And in this regard, I want you to take a look at and feel what part of your foot your weight is going through. Is it through your heels or through your toes? And what I'd like you to do is work towards having your weight evenly between the front and back of your feet and side to side. So evenly on both feet and both in the front and the back. Once you have that, next we'll draw attention to the knees. So hyperextend the knees so they're slammed all the way back. And from there, loosen your knees. So let them relax, yet you haven't yet lost height or bent your knees yet. So they're just soft knees. And you've got the ability to push them back. So you're looking to have soft knees, and then from there we'll go up to the pelvis. From the pelvis standpoint, we like you in a neutral pelvis, which means you've got the ability to stick your butt out in the back, and you've got the ability to tuck your butt under. Okay? So for a neutral pelvis, you'll be somewhere in between, where you've still got room to go back with your butt and still got room to tuck your butt under further. So in the middle. So starting from the foundation again, weight is even in the front and back of your feet, knees are soft, and your pelvis is positioned in such a way that you've got room to go back and room to go forward with your pelvis. From there, we're going to look at the rib cage. Often the rib cage is in the back, so you're in the back seat, way back here, and hips are forward. We're going to come back up onto our hips and make sure that rib cage is over top of our pelvis. This is extremely important. We want the diaphragm over top of the pelvis and the pelvic floor, such that the pelvic floor can be working well during and throughout your pregnancy. So rib cage over your pelvis. And then from there, we'll look at the shoulder blades. So if you shrug your shoulders up to your ears, so straight up to the ceiling with your shoulders, and then let it go, let it relax. And your shoulder blades will naturally drop down and back into a good position. And then from there, looking ahead, you'll see that your chin isn't forward. It's been tucked back a little bit, such that the side of your ear is in alignment with your shoulder. What you'll find in this position is that you're very stable. So you've got a good, strong base of support from which to support yourself and the growing baby. So from here, this is an ideal standing position. When we start to walk, what we want to think of is drawing our belly button towards our spine. This will engage the transverse abdominis muscle, which is important for stability purposes. And then from there, I'll have you start walking. As you're walking, what's important to think about is that it's from heel to toe. So heel to toe as you walk, and pretend that you're walking over roots or small rocks as you're walking. So it's a deliberate walk, heel to toe, opposite arm, opposite knee as you're walking, which looks good. Engaging that transverse abdominis by drawing your belly button towards your spine, and then looking ahead as best you can while you walk. Walking is extremely important while you're pregnant. It is something that most of us don't do enough of, and we should be looking to get 7 to 8 kilometers a day of walking, and ideally space that out over the course of the day. It's not something that has to be done all at once. And if it's something that you don't usually do, take the time over a matter of weeks to build yourself up to be able to sustain walking for 7 to 8 kilometers. It's all the muscles that we need to be able to carry a healthy baby to term, as well as ensure that we have the muscles that we need to prepare the body for delivering this child.